Dr. Saray Stancic says she did everything her doctors told her to do when she was diagnosed with multiple sclerosis, but her disease progressed. So she decided to investigate if there was a link between her diet and her disease. She says when she started researching, she found plenty of evidence showing a connection, including the work of neurologist Dr. Roy Swank, who studied MS patients for more than 30 years in Norway, where the prevalence and incidence of the disease have frequently been reported. He first noted that there were more MS cases in the mountains where meat, dairy, and eggs were consumed regularly than in the coastal fishing communities.
And he hypothesized in the 1950s that somehow saturated fat was playing a role the pathogenesis of multiple sclerosis. But he didn't just hypothesize, he actually started to treat patients with a low-fat plant-based diet. And he followed a large cohort, 140 plus patients over 34 years. And he concluded in a publication in 1990 in The Lancet that those who adhered to his diet, 95% of them remained physically active. So 95% of them were free of disability.
This is where you walk every day?
Every day, yeah.
But she says when she went to her doctor with the information she found, she didn't get the reaction she expected.
And he said, you should know better. You're a doctor. I know it's not what you want to hear, but the truth is that you need to remain compliant with your medicines. And if you want to blame anything for having MS, it's because of your genes, and there's nothing you can do about that.
Disheartened, she said she turned to the research again. If genes really were to blame, then surely someone had studied the likelihood identical twins would both be diagnosed with the same disease.
And if my doctor was right, if twin A has MS, then it's going to be close to 100% that twin B would also have MS. So again, I turned to the scientific literature looking to see what if anybody had answered that question. Of course, someone had, and it wasn't 100%. It wasn't even 50%. It was 14 to 33%.
She then took a deep dive into epigenetics.
Epigenetics essentially tells us that gene expression is dependent on outside variables. That just because you have a genetic predisposition to a particular disorder doesn't necessarily mean that you will have that disease. And what does epigenetics tell us is important? What are the factors that play such an important role on influence the expression? It's things like diet and exercise and sleep and stress. It's lifestyle.
That's when she says she decided to change her lifestyle.
I adopted a whole food plant-based diet, one rich in fruits, vegetables, whole grains, legumes, nuts, and seeds, because the overwhelming evidence in the scientific literature spoke to that was the ideal diet for human health.
She also made other lifestyle changes like learning how to sleep without meds, lowering her stress level, and exercising, something that was not recommended for MS patients at the time.
I was going to put myself first for the first time in my life. And it didn't happen in a week and it didn't happen in a month, but over time, I started to feel better.
Years later, in 2010, her health had improved so much, she was able to run a marathon.
And today, it's going to be 26 years since my diagnosis, and I am medication-free and disability-free and empowered more than ever before to share this healing message with whomever is willing to listen, because this isn't complicated. Anybody can do this.
She attributes her good health to the changes she's made, like switching to a diet rich in plants and free of animal protein, processed and refined foods, very different from the standard American diet filled with saturated fat, mostly derived from animal products, as well as processed and artificially sweetened foods. And that's not even counting our junk or fast food problem.
America's obesity epidemic is apparently getting worse.
And more than double that number, 88 million, have what's called pre-diabetes.
According to the CDC, more than 42% of Americans are obese, and one of the diseases associated with obesity is type 2 diabetes. Studies show Americans consume an average of 152 pounds of added sugar each year, which is included in products such as the sodas we drink and our breakfast cereals.
So diabetes is one of the conditions that reacts to a change in lifestyle quite rapidly. And it's not an issue of sugar, which a lot of people think, I'm just eating too much sugar and so I have diabetes. But it's actually an issue of fat. Eating a diet high in fatty foods can cause an accumulation of fat inside our cells and interfere with the ability of the insulin to move the sugar out of the bloodstream and into the cells. So instead of powering our cells, it's actually building up sugar outside of our cells, causing diabetes.
She's referring to the fat we accumulate in our bloodstream when we are overweight or consume an excess of high fatty foods such as butter that has 45.6 grams of saturated fat per 100 grams. But if we're not eating animal protein, then what should diabetics be putting on their plate?
We've been told in the last decade maybe that carbs are bad for you.
So we lump all carbs or carbohydrates into one big bucket, and that's very unfortunate, because you can't compare, simple sugars with complex carbohydrates, which are whole grains and fruits and legumes.
As for heart disease, Dr. Ken Williams, the past president of the American College of Cardiology, has actually promoted a plant-based diet, citing studies like the one Dr. Caldwell Esselstyn conducted with 24 patients between the ages of 44 and 68 who had severe coronary artery disease, had unsuccessfully undergone bypass or angioplasties, or were deemed too sick to undergo surgeries. 5 of them were told they would die within the year.
His patients were ones that were sent home by their physicians because they've already been through bypass surgery and medications, and their medical providers thought there's nothing else we can do.
In that study, the doctor kept patients on their cholesterol-lowering medications and took away meat, poultry, fish, dairy products, eggs, oil, added sugar, and processed foods, leaving them on a whole plant-based diet. The group started with an average cholesterol level of 246. Of the 24, 17 followed the diet for 12 years and ended up with an average level below 150, without one more cardiac event or the need to undergo another surgery, such as heart bypass, that is done more than 200,000 times a year in the United States, at a cost of $6.7 billion. According to Dr. Negron, the problem with relying exclusively on these surgeries is that they only correct one obstruction at a time. But we have thousands of miles of blood vessels in our body, and the only way to try to address our entire cardiovascular system is by feeding it better, including foods such as leafy greens into our diet that produce nitric oxide.
So we know that by eating plant-based foods, we are reducing the amount of animal protein, the amount of fats as well. And if we're eating foods that are high in nitrates, for instance, that converts to nitric oxide in our body, which helps in our cells for our arteries to be able to dilate when needed. And so they're more flexible, and we have a healthier cardiovascular system.
But a plant-based diet doesn't just mean eating salads.
You can eat rice and beans and oats and quinoa and cabbage and Brussels sprouts and pumpkin and papaya and sweet potatoes and nuts and avocado. From the animal kingdom, all you get is meat, dairy, and eggs. From the plant world, we would be here sitting until we are 90 years old, and we wouldn't exhaust the list.
In our next episode, we introduce you to a personal trainer who says this type of diet not only helped him recover from a chronic disease, but it's beneficial for athletes looking to improve their performance.
A lot of players, like top players, they doing plant-based. Why? All of them say it's because the recovery is faster.